Hello, I'm Dr. Jawad Bashir. I'm one of the consultant endocrinologists at King's College Hospital, Dubai. Today I'll tell you some things which are vital to know about the condition diabetes. And the reason we are having this conversation today is because this is the month of November, which is considered the month to remind ourselves about the importance of diabetes and get ourselves screened if there is any risk factor in ourselves or in our family members. I'll take you through the history of diabetes, where did this term originate from, and why do we celebrate the World Diabetes Day on 14th of November. Let's have a look at a few historical facts. Now, the terminology diabetes has been there in historical scriptures for a very long time. You can ask your family members, your grandparents, they would be aware of this term diabetes.
Let's dive back in time and find out what was happening to the human civilization when they would live in tribes like this. So they have a chief and some kids who were very strong and others who were just peeing, and there were a lot of ants coming where they were passing urine. These kids were very skinny and they were not fit for the tribe because they were always passing a lot of urine, they were always eating a lot of food, and they were always drinking a lot of water. They labeled these kids as having the condition named diabetes. So we were pretty good in diagnosing diabetes based on the signs and symptoms. Unfortunately, there was no treatment for this condition, and these kids were sentenced to death. They were not fit for the tribe until 1920. It was only in 1921 that we had the discovery of a life-saving therapy named insulin, and when it was given to this young girl, she survived. This was a transformative therapy because her whole body transformed into a completely normal person, and for the first time, a person with type 1 diabetes survived to live longer than a few years of lives. But unfortunately, after a few years, all patients who actually survived with diabetes were blind. This was quite a concerning finding because prior to 1921, patients with type 1 diabetes would actually die. But when they actually started to live, we realized something happens to their eyes. Insulin was still a breakthrough discovery because the patients couldn't survive without insulin, and therefore Frederick Banting, who actually discovered insulin, received Nobel Prize along with his team. On one end, we had celebrations of a life-saving discovery, but on the other hand, we had upset parents that their children were turning blind. It wasn't a life they wanted their children to have. It took us 21 years after the discovery of insulin to realize that insulin syringes have to be designed to give insulin in more accurate formats in form of units. And at the same time, we need a monitoring tool, which was again urine in form of urine dipsticks. In 1954, we had another discovery by the French team who discovered a chemical. If that was given orally, you can see that the urine glucose vanishes. They named this compound metformin with a brand name of glucophage that majority of you may still be aware of, meaning it's a glucose eater. This was the first time we realized that not everyone with diabetes needs insulin. They can also be treated with oral tablets. And we were using certain terms like NIDM, which is non-insulin dependent diabetes, or IDM, which is insulin dependent diabetes mellitus. Interestingly, up till this time, we were only using urine as a monitoring tool for sugars. And it was only in 1964 that we had devised capillary blood glucose testing method, and the commercially available glucometers came into the market in 1970. Finally, in 1979, we had the HbA1c, which is a 3-monthly average blood sugar that some of you guys may already be aware of for monitoring of diabetes. Now, before 1921, diabetes used to be a lethal condition, and it's been more than 100 years since the discovery of insulin, yet still it continues to be a lethal condition. Till 2019, a death from diabetes would happen every 8 seconds across the globe. And in 2023, every 5 seconds a person with diabetes dies, which means that we have to do something about this condition, which is quite prevalent on Earth. By 2021, we had every 10th person suffering with diabetes, which is a big burden on the society. So we have to know how many types of diabetes actually exist. I will try to keep it simple. Type 1 diabetes is the type of diabetes in which individuals require insulin from the beginning. They are very skinny and they would need to stay on insulin throughout their lives. Then we have type 2 diabetes, which is related to our weight, and these individuals actually start putting on weight which means that this diabetes can be reversed if you lose weight. Another type of diabetes is called gestational diabetes, which is again similar to type 2 diabetes and happens in relation to weight, but usually presents only during pregnancy. But why do people actually get diabetes, whether it is type 1, type 2, or gestational diabetes? Type 1 and type 2 have substantial differences in how they develop. Type 1 diabetes patients carry a genetic risk of developing this condition by production of certain autoantibodies which are destroying the beta cell mass in their pancreas, which normally releases insulin. So there is a progressive decline in insulin which leads to progressive rise in glucose levels. It can present quite suddenly with symptomatic onset of high glucose levels with dropping weight and production of a lot of urine. Sometimes they can also present with blurry vision and feeling extremely unwell with nausea and vomiting and conditions like diabetic ketoacidosis because their body is not producing any insulin to help them sustain a normal life. Survival of these type of patients is not possible without insulin, but with the introduction of insulin, their bodies can transform and they start to lead a healthy life provided they are getting proper and adequate supervision. Type 2 diabetes presents very differently and is usually related to insulin-resistant state. Normally, you need 2 molecules of insulin to control 1 molecule of glucose. As a simple example, this is the ratio which helps keep our glucose and insulin in a balanced state. Glucose comes from the carbohydrates and insulin comes from the pancreas. Over time, our insulin becomes very lazy and 2 persons' job is handed over to more than 2 people, so you require more and more amount of insulin to control the same level of glucose, which means there is a lot of burden on the pancreas, which eventually leads to progressive gain in your weight. This is called an insulin resistant state, which is a precursor for type 2 diabetes. It leads to weight gain, which eventually leads to pre-diabetes as your average sugars rise further, and ultimately you develop full-blown type 2 diabetes. So the initial state of type 2 diabetes is much different when you can sometimes have impaired fasting glucose. But if your fasting glucose crosses the 126 mg per deciliter mark, it is already too late because you have developed type 2 diabetes. Prior to that, you sometimes see a rise in your glucose levels after meals, which goes unnoticed, but at the same time, the insulin levels are rising in your body, leading to significant rise in your weight. State of insulin resistance goes unnoticed and most people do not receive much therapies. Some of the complications related to diabetes have already developed even prior to the diagnosis. We would be very lucky to be captured in a state of pre-diabetes or perhaps in a state of insulin resistance when people receive treatments like metformin. However, by the time patients are diagnosed with type 2 diabetes, they may already have developed complications related to diabetes which can be linked to our eyes, kidneys, heart, or brain. Most of the patients with type 2 diabetes eventually receive some form of management after the diagnosis of this condition. So when should we start screening for diabetes to ensure that we don't get these complications? There are a lot of screening tools as well as signs and symptoms that you can look out for, which can point towards the underlying diagnosis of diabetes. The American Diabetes Association has designed this self-assessment tool, which is quite handy and can serve as a screening pathway for yourself at home. You can simply fill out this questionnaire, which looks at your age, your gender, your previous history of pregnancy-related diabetes, any family members who have got diabetes, what's your activity level, and your BMI. If you're scoring high on this self-assessment tool, you need to get screened for diabetes. It is also easy to spot signs and symptoms in your children or yourself if you're passing a lot of urine, feeling very thirsty, very tired, and you feel you're thinner than most of the individuals around you, or you're losing weight unintentionally. Get yourself screened for type 1 diabetes. There are additional signs and symptoms that you can always watch out for. For example, certain dark pigmented velvety patches on your neck, underarms, or groins, which means this is acanthosis nigricans, a sign of insulin resistant state. Similarly, recurrent urinary tract infections, that can also mean that you may have high blood sugars. or you're feeling very tired and fatigued all the time, and sometimes blurry vision can be a presenting feature for high blood glucose. All pregnant ladies must be screened for gestational diabetes, and this has to be a universal thing for all pregnancies around 24 weeks of pregnancy. But if you belong to certain ethnic backgrounds like Asian, Arabs, or Afro-Caribbean, or you have had previous pregnancy with gestational diabetes, or previous delivery of baby more than 4 kilograms, or you have first-degree relatives who suffer from diabetes, or your BMI is above 30, you must be screened for gestational diabetes at 12 weeks of your pregnancy. The next question would be that how should we screen ourselves for diabetes regardless of the type of diabetes? It can be as simple as a finger prick test of blood glucose in a fasting blood sample. For type 1 and type 2 diabetes, a fasting blood glucose above 126 milligrams per deciliter or an HbA1c above 6.5% helps you secure the diagnosis. But for gestational diabetes, we use an oral glucose tolerance test, which is a glucose challenge of 75 grams of glucose given in a fasting state. And if the fasting glucose is above a certain limit, which is above 92 milligram per deciliter, or your 2-hour glucose is above 140 milligram per deciliter, you have got gestational diabetes. Now that we know diabetes is a major global problem, how do we prevent this condition? Is there anything that you can do? Type 2 diabetes and gestational diabetes are preventable, but they're not curable. And it's usually through our lifestyle, which may include what you eat and what you do in terms of activity. It is also useful to know where does this blood sugar come from in our blood. It's an impact of different types of foods that we have in our daily routine. Whatever food items we eat, if they do include any form of carbohydrates, they are digested in our intestines into small particles which give us energy, and that's the sugar or the glucose. After any meal which contains carbohydrates, our blood glucose starts to rise. But behind the intestines, an organ named pancreas is releasing insulin to control our sugars. So as soon as blood glucose enters the bloodstream, the insulin comes at the same time to drop the sugars back to their normal level. For some reason, if the pancreas is removed or if it is not functioning, the blood glucose will continue to rise to sky-high levels, and this condition is called diabetes. So whether you have type 1 diabetes or type 2, there is either lack of insulin, which would be type 1 and requires treatment with insulin, or there is insufficient activity of insulin. What happens to the carbohydrates in our body? Basically, the carbohydrates are a type of fuel that's present in variety of food items. Whether it is bread, rice, cereals, whenever you have carbohydrates, it's broken down in the intestines to release the tiny particles called glucose that enters the blood and provides a source of energy to our brain. Our brain cannot function properly if carbohydrates are missing. And that's one of the reasons that blood sugar readings fluctuate depending on your fasting state or the state of satiety. Carbohydrates exist in a variety of forms, as you can see from these pictures. Almost majority of our meal items would have some form of carbohydrates unless you go on a keto diet. Carbohydrates can have an impact of rapid rise of sugar or a slow rise of sugar. This brings in the idea of glycemic index. Glycemic index of a carbohydrate helps us evaluate how quickly the blood sugar will rise after having a certain type of carbohydrate. For example, the low glycemic index food is actually going to have a gradual impact on your blood glucose levels, while medium and high glycemic index food items would cause a significant rise in your glucose levels. Therefore, the best foods for diabetes are those with low glycemic index. High glycemic index food items are not the best one. Even fruits have sugars, and it's important to know which fruits have high glycemic index carbohydrates, which will help us decide the best fruits that we can have if we have diabetes. Similarly, it's always useful to know about the glycemic index of carbohydrates which you're eating, and this would help you choose the best food items for managing your diabetes. It is interesting to know that the glycemic index of a certain food item can be changed by how you cook it, what's the fat or starch content, what's the fiber content, and how you store your food items. What about glycemic load or portion control? Glycemic load is a separate measure of how the food would impact your glucose levels and mainly depends on the portion size. If you have got a high glycemic index food, it will quickly cause the rise in blood glucose levels. But if the glycemic load is high, then the levels of the sugars will go extremely high. You can use certain calculators to find the glycemic index as well as calculate the glycemic load. Let's look at some practical example of fruit items. For example, you have a banana, which is a low glycemic index, and watermelon, which is a high glycemic index fruit. However, we know that in watermelon there is more water content, so the glycemic load is less. But if the banana is very ripe, the glycemic load can be very high and it can give you a very sharp, steep rise. Similarly, if you are using a little bit of raw banana, which has got lower glycemic index and lower glycemic load, that would actually serve a better food item for you, which will not give you a rapid rise like a ripe banana, and also it will not give you a rapid rise like watermelon. So you can always look at the glycemic index as well as the glycemic load of food items and try to work around what is the best one. The worst food for a patient with diabetes are those which have high glycemic index and high glycemic load. They are only the energy drinks that we would be using whenever there is a state of hypoglycemia. Portion control is extremely important for patients with diabetes, and make sure you use the plate pattern, which should have a mixture of vegetables, proteins, and fiber. Look at the labels, measure the amount of carbohydrates if you can, and take your medicines regularly. Now that we have talked about eating habits, how much daily activity do we require? And how strenuous this activity has to be? The guidelines advises that we should have 30 minutes of daily activity 5 days a week, which gives you a weekend off. And this has to be a moderate intensity activity. The 30 minutes do not have to be done in one go. You can split them in sections of 10 minutes 3 times daily. What about people who have jobs and they're sitting for 9 to 10 hours daily continuously? Follow the rule of 30. Have a 30-second break every 30 minutes, which can be a simple stretch or anything that makes sure that the circulation of your blood continues in your legs. Reduce the amount of alcohol you intake, avoid smoking, look at your step count, interrupt your periods of inactivity by doing a little bit of stretch, ensure that you do a self-screening assessment if you are at high risk, look at your eating habits, and if you are ever in doubt, we're not too far from you, and we're always happy to advise and guide you about your health. Thank you very much.